We have 6,764 cases in total from a week ago when I last reported. If we look at our data Sunday to Sunday instead of Tuesday to Tuesday, then our most recent week, starting on the 28th of February, we had 208 cases, and that's down from the previous week, February the 21st, of 255, which in turn was down from the week before that at 277. If you go the week before that, it was 211. So basically what we had was a downward pattern from the beginning of January, then the week of, between the week of the 7th and the 14th, a 30% jump. And since that time, we've had some decline, which is, of course, good news. I do wish to acknowledge the loss of one individual who's passed away. A man between the ages of 65 and 79 from Simcoe County. I would like to express my condolences to the family members for your loss. We actually, in our database, don't have the date of his passing, and so it may very well have been in the last week, probably, but I don't actually have that date. At present, we have 372 active cases, which is down from a week ago at 468. We have 6,144 recovered cases, up from 5,816 from a week ago. Presently, we have 18 people in hospital, people from Simcoe, Muskoka in hospital. 6 of them in the intensive care unit. Their ages range from 40s to 90s. 12 of them are sporadic cases in the community, and 6 are associated with outbreaks. Since the beginning of this week, on Sunday, we've had 72 cases, and in the last 24, we've had 30 new cases. They include 28 that are sporadic cases in the community, 1 from an institution, 1 from a workplace that's out of jurisdiction, out of our territory. 22 of them are men, 8 of them are women. Their ages range from under 10 to in their 70s. We have 29 of them in Simcoe County and 1 from Muskoka. And 3 were acquired in the community, 12 were close contacts of known cases, and 13 are under investigation. 28 of them are in self-isolation, 1 has recovered, and 1 we're investigating. The vast majority of our new cases are from South Simcoe and Barrie, which is almost always the case. So Bradford, West Gwillimbury, New Tecumseth, and Innisfil, as well as Barrie. If we look at our incidence of cases per 100,000 population per week, this week Penetanguishene has the highest rate at 72 cases per 100,000 population per week, and that would be largely linked to some cases in CNCC Correctional Institution. We have 64 cases per 100,000 population in Barrie, and 63 cases per 100,000 population in Tay Township. And Muskoka right now, the town of Huntsville actually has a fairly high incidence per 100,000 population of 46 cases per week. Of note, on March the 28th, from yesterday, we had 11 new cases in Huntsville reported, bringing their total for the month to 12. So that's a high number for that community. They aren't part of an outbreak. They are family clusters and individual cases. In terms of educational institutions, since the beginning of January, we've had 115 COVID cases identified among staff and students. And of course, the majority of that would have been since there's been a return to school, in-class instruction. 75% of them are in elementary schools and 25% in secondary schools. And this is something we call educational settings. So that is schools, but it's also, by our definition, child care centers. So we've had 22 cases in child care settings between staff and students. The majority of these were single case exposures, not outbreaks. So at this point in time, we've got 3 schools that are in outbreak and 1 child care center in outbreak. And by outbreak, we mean there's evidence of some transmission on the site, not just a single individual who exposed others to COVID-19 through their attendance while they were symptomatic or while they were incommunicable. We have a total of 682 cases of variants of concern, whether it would be the B117 UK variant, whether it would be now the Brazilian, the P2 variant, or whether it would be, I beg your pardon, the P1 variant, or whether it would be in individuals that have screened positive for a variant awaiting confirmation as to what type. In terms of the B117 variant, we have 225 cases, which is up from 191 a week ago. In terms of screen positive individuals for a variant of concern to be determined as to which type, 455, up from 352 a week ago. We've had 2 cases of the P1 variant, first identified in Brazil. Both are, one's a close contact of the other, and the other is associated with an outbreak in a workplace out of jurisdiction. And this is within the individuals themselves are within Simcoe County. Just one of the things I would note about trends for the variants of concern, week on week, what's happening. So if we look at the totals week on week, we've actually had a little bit of a reduction in the last complete week that we've been following from the 28th of February at 95, as opposed to the week before, the week of the 21st at 119, and the week before that was 119, and the week before that was 73. So basically it was coming up and leveling out and has come down a bit, which is good news. Okay. In terms of where our variants of concern have occurred, we've got basically 97% of our cases in Simcoe County and 3% in the District of Muskoka. So a total of 658 cases in Simcoe County. This is cumulative from the very beginning, and that's up from 527. 63% of these have been sporadic cases, and the rest of them have been related to outbreaks. And in the District of Muskoka, we've had 24, which is up from 16, and 17 of those have been sporadic cases, and 6 have been workplace outbreak related, and 1 an institutional outbreak case. So one of the things I would note is that we've had an increase in the proportion of our cases that are sporadic, that aren't part of outbreaks. So for the week of February the 28th, 79% of the variants of concern were sporadic, and 7 were related to outbreaks, 7%, compared with 68% related to outbreaks and 2% sporadic cases back in January the 17th. So that's a complete change from January, basically going from most of those at that point were due to outbreaks, and now most of them are unrelated to outbreaks. We have an increased percentage of our total COVID cases being variants of concern. So for the week of February the 7th, 53% of our COVID cases were variants of concern, And for the week of February the 28th, they're up to 67%. And currently for this week, although this week is not finished, we have 68% of our cases being variants of concern. So basically what we're seeing is the variants of concern taking over and dominating among our COVID cases. And this is what we would have predicted, considering that they're more communicable. But we're also seeing that as a whole, their number has started to come down a bit, and our total case count for COVID has also come down a bit. In terms of outbreaks, we have 9 active VOC outbreaks, variants of concern outbreaks. All of them are in Simcoe County. 5 of them are in workplaces, 1 of them in a long-term care facility, and 2 in educational settings, and 1 in what we're calling a community setting. Basically, it was, in terms of the community setting, you had a personal service setting, which is the setting category that we include for salons and spas, barber shops, and so we had an outbreak among staff in that facility, and now we've had also a client affected by this. We do follow up with all of the clients because these facilities, these businesses keep lists of their clients, so we're able to reach them all in order to identify those that are high-risk contacts to be followed up for investigation. But as I said, overall, the total number of cases of our variants of concern have gone down a bit. And also, in the past week, the total number of outbreaks of our variants of concern have gone down a bit. So the week of February the 21st, we had 6 variants of concern. That was the peak number. And for the week of the 28th, we had 3 variants of concern. And so for this week, we've had no new outbreaks of variants of concern. So once again, I'm talking about the outbreaks themselves. 6 outbreaks of variants of concern February the 21st. February the 28th, there were 3 outbreaks of variants of concern. If we look at the active current outbreaks, both with or without variants of concern, we now have 18 in total, which is down from 28 outbreaks a week ago. So not only are the outbreaks from variants of concern going down, but our total outbreaks, all COVID outbreaks, have been going down over the past week. And 9 of the 18 active outbreaks are from variants of concern. So we now have 6 institutional outbreaks, down from 10 a week ago. The 4 that were declared over, there are no new ones, so 4 that are declared over are Bradford Valley Long-Term Care Facility, Waypoint Mental Health Facility in a geriatric unit, Sarah Vista Long-Term Care Facility, and Barrie Manor Retirement Home. We have no outbreaks in congregate settings. We have 6 outbreaks in workplaces, down from 13. 1 new outbreak in a retail location in Simcoe County, 6 outbreaks declared over at a food premise in Muskoka, an agricultural setting in Muskoka, 3 manufacturing facilities in Simcoe County, and food processing facility in Simcoe County. We have 2 community settings in outbreak, which is unchanged, an ambulatory health care service in Simcoe County, and a personal service setting in Simcoe County, as I'd cited before. We have 4 educational settings that are in outbreak, up from 3. So a new one is an outbreak in Holy Trinity Catholic High School in Bradford, and this is not a VOC outbreak. And the existing outbreaks are St. Teresa's Catholic High School in Midland, which is not a VOC outbreak, Maple Grove Public School in Barrie, which is a VOC outbreak, and a child care setting in Simcoe County, which is a VOC outbreak. In terms of our vaccination status to date, we have administered 51,000 doses of COVID-19 immunization vaccination. This is up about 8,000 doses from last week. This includes 15,700 individuals who've received both of the required doses of vaccine. just to give a bit of a sense of the breakdown about all of that, to date we have immunized 3,602 individuals in the community who are 85 years of age and above, and we've immunized 184 individuals who are on chronic home care. We've immunized our 4 First Nations communities, and are proceeding with working with leadership in the urban Indigenous community in order to bring immunization to that population. In terms of long-term care facilities, we've immunized some 3,000 individuals, and 2,787 of them have received their second dose, and they make up about 94% of all the residents of long-term care facilities. And with the retirement homes, also 94% of the residents have received immunization. To get into the numbers, 3,429 residents have received their first dose, and 2,431 have received both doses. So the 94% figure would be of those who've received their first dose, or both, one or the other, right? But others that I would note, some large numbers here. The healthcare workers who are considered highest priority, high priority, or very high priority. We've provided 8,298 doses, although the great majority of them have not received their second dose. So there are many other categories that have received immunization as well: essential caregivers and long-term care and retirement homes and hospital workers. We've had over 5,000 hospital workers who've received both of their doses, are fully immunized. The workers in retirement homes and long-term care facilities, thousands there, so 2,684 healthcare workers in long-term care facilities, and 1,177, 1,477 healthcare workers in retirement homes have received both of their immunization doses. So making progress on that. And I will be talking a little bit later about where we go from here with our immunization clinics and our mobile teams. In terms of our health unit dashboard, and this is not the same framework as the province's framework, just our own dashboard, we are in yellow status as we were a week ago, so that's not changed. Viral spread and containment we continue to keep in a red category because we still have a relatively high number of cases and outbreaks. Laboratory testing, it remains in yellow with a one-day turnaround percentage of tests being below the desired 60% at 53%. And our percent positivity of tests has not changed at 1.5%. The healthcare system capacity remains at yellow, with acute bed occupancy being 81.4% as opposed to the target of below 90, so that's good, but ICU occupancy being 63.5% and ventilation bed use at 30.8%. And in terms of our public health system capacity, we are at red because we're still challenged in our ability to be able to get to our cases and our cases within 24 hours. Our target is 90%, and right now we're at 80.3%, which is up from last week at 69.7%, but still not on target. In terms of the provincial dashboard, we've been in red since Monday, March the 8th. We have just looking at our trend overall. We have a weekly incidence right now of 35 cases per 100,000 population per week. So this is lower than the actual typical threshold that the province uses for being in red. at 40 cases per 100,000 population per week, and that's down. We note that the province's rate by comparison has gone up a bit over the past week at 53.2 cases versus 52.4 cases per 100,000 population per week last week. Our average growth rate is slightly down at 0.5%. Last week it was 0.6%. The province is at 0.4%. And as I've noted, our percentage of variants of concern as a total of all of our COVID case counts has been going up. We anticipate it'll continue to go up. It's presently 67%, up from 61% a week ago. Our reproductive number is at 1, which is unchanged from a week ago at 1, and is the same as the province is at 1. Anything 1 or above means there's a potential for growth, and we know with the variants of concern it can be that much more sensitive to the potential for growth. And our doubling time has increased, which is also good news. It's 165.4 days, up from 124.5 days a week ago. We are starting to get data about wastewater monitoring for both COVID-19 overall, for 4 of our communities, and for the variants of concern for the city of Barrie. This has been done by the Ministry of the Environment, but also by the University of Ottawa with regards to the variants of concern. So we found from the University of Ottawa's data that we had some detectable level of the COVID variant of concern in late January, and then early February it declined to be non-detectable, and then later in February went up again, and very much following the pattern of the cases that we've seen for COVID variants of concern. And then most recently it's become non-detectable again, it's dropped down again. So that correlates with our actual case count, and it would be yet another form of surveillance that we can use to monitor risk in the community. And the monitoring that's otherwise been done by the Ministry of the Environment for the city of Barrie, Collingwood, Midland, and Orillia. For Collingwood, Midland, and Orillia, they've been monitoring to date, but actually haven't been able to detect COVID-19 with their monitoring. And this probably would correlate with relatively low levels of cases in those communities. So I have, of course, detailed information on all of the outbreaks that have been happening, but I think from this point onward, considering that I'm giving a fair amount of the high-level information about the outbreaks, I will leave it to any questions that might arise about specific outbreaks, and instead I will go to some of the key points from my media notes that I want to make. So with regards to entering red status, as I've noted in my letter to the community, we have numbers, at least last week, that would correspond with that. And I've also noted that with the variants of concern, there is the potential for that to change and to go in the wrong direction. Certainly the province is watching this very closely. And there is some inquiry about the degree to which the province would change its framework potentially to address a hazard associated with variants of concern, the potential for them to be more transmissible, the potential for a third wave. So that rests with the province to consider. We are going to be proceeding with some additional orders to add protection to the community. Under the Health Protection and Promotion Act, I can issue an order called a Section 22 to require actions to be taken. And so we have one order that is to the general community, and it's augmenting a previous one I made, in which basically individuals who were diagnosed as cases of COVID-19 or were high risk, had a high risk contact with a case of COVID-19, were to go into isolation until they were no longer infectious to other people. Or until, in the case of contact, they had gone through an incubation period and not become a case. So that's already in existence, but what we're adding to that is language in keeping with the screening tool from the Ministry of Education for students and teachers attending work. And that is, if there's somebody in the household who might be a case of COVID-19, that they have the symptoms of COVID-19, that others in the household also need to go into isolation until that person has been assessed and had a negative test, been determined not to be a case. If it turns out they are a case, then the others are contacts. They need to remain in isolation as well for an incubation period to contain the spread. So that's a precautionary augmentation in keeping with what's already happening in schools. And we also have an order coming out that would require that kind of action for those service providers who provide care to vulnerable individuals in long-term care facilities, retirement homes, or private residence, so home care provision as well. So those workers too, just like everybody else, if they've been in contact with a individual who has symptoms of COVID-19, they need to be isolating until they know that that person is negative, that they've been tested and that they're negative. And for that matter, they need to be in isolation if they themselves become a case, or if they've had a high-risk contact with a known case of COVID-19. So this is meant to be more protective of basically patients and residents receiving care who are vulnerable. And finally, we are going to be coming forward with a slightly strengthened letter of instruction. I already have one out to businesses with regards to them being workplaces, so businesses and other workplaces. There's already a letter from me that's basically supporting employment standards right now for COVID-19. Is just to heighten the awareness of those standards and to enable the health unit to also enforce those standards, not just Ministry of Labor enforcement officers. And it's all about screening of employees for symptoms before they come to work, and excluding employees that may be cases, and also sorry, my pet dog has just distracted me. Requiring mask use, distancing, barriers, all of the sanitation, the usual practices are cited again in my letter of instruction. This is meant to address the work environment and keep work environments safe, considering that more recently that's where we've been seeing outbreaks happening. In terms of vaccination, I've already spoken to the numbers. We're very fortunate that we've been able to start up all of our 13 community clinics over the past week, doing this in partnership with family health teams and hospitals and paramedic services in municipalities. And community pharmacists, so it's very much a coming together of the community to be able to bring immunization to the community. And we now have an excellent base of provision of vaccines, so that when we start getting a lot more vaccine from the province, which we anticipate to be coming in 2 weeks, that we'll be in a really good position to be able to administer it well to the community. Certainly I look forward to us getting a lot more in the way of vaccine. Just if you want to get to some specifics about what's coming up in the next week, clinics, Today are open in Midland and Wasaga Beach and Huntsville and in Barrie. At Barrie, there are 2 clinics at the Holly Center. And they are by appointment only. If we have people drop by, we would politely ask that they would look into how they would book. This is important for us to be able to give this to priority groups that are most vulnerable, working through our priority groups based on the province's direction, and to also avoid lineups. We don't want crowding because that would put people at risk of transmission from COVID-19. We would direct you to have a look at our website and call us. We've, at this point, booked up for the immediate future. We anticipate in the near future that we're going to be able to open up things again for further bookings, and we will communicate that out once we've got that ready to go. We also know that the province is moving to a centralized booking system on the 15th of March, and we will go through a transition with our own booking system to then be supporting their booking system. So we will communicate about that as we carry out that transition. One of the things that we note from the province is that they are giving more additional vaccine to areas that they call hotspots, areas that have had higher rates of transmission of COVID-19, and Simcoe, Muskoka is considered one of those hotspots. It may be that they're taking into account our experience with the variants of concern as well. I don't know, but we are getting additional vaccine starting, as I said, in 2 weeks related to that. We're also going to be starting to be receiving AstraZeneca. We're part of pilots related to that. So that'll be happening soon, and that'll be a partnership with primary care. And we will soon be receiving Moderna vaccine as well. And so that also gives us more options. Moderna is a little easier to handle than the Pfizer vaccine, and AstraZeneca is much easier to handle than either the Moderna or the Pfizer vaccine. The province is extending out the intervals between the 2 doses of vaccines. So far the Moderna, the Pfizer, and the AstraZeneca all require 2 doses, but now the province, in keeping with recommendations from the National Advisory Committee on Immunizations, will be allowing the second dose to take place as far out into the future as 4 months after the first dose. So we do get a strong response from the first dose of these immunizations, and therefore it would be very helpful to everybody if we're able to get a first dose to more people sooner. So by being able to delay the second dose, we'll be able to get to more people sooner and offer protection to people, a larger group of people sooner, basically getting us to the point that we're offering it to everybody sooner so that everybody gets a chance earlier, quite a bit earlier, to get their first vaccination. We are now 1 year into officially the COVID-19 pandemic. On the 11th of March last year, the World Health Organization declared COVID-19 to be a pandemic. And very sadly for us, that was actually the first case that we knew of COVID-19, which turned out to be also a death, and was the first death in the province of COVID-19. So I think we should stop for a moment and reflect on that and all that has transpired since. So we've lost over 180 individuals to date from this disease. More than 6,700 people have been infected here. Many others have been forced into isolation and quarantine as contacts. Over that period of time, we've come to use masks as a norm in indoor public places and in outdoors when crowded and in workplaces. We've felt many of us the loss of income and employment and business. So it's been extremely hard on many fronts, not just those who've contracted COVID-19, but those who have been affected in these other ways. We've had healthcare change so that it's virtual now. You're more likely to see your family physician on a screen than in person. Same with counseling. In terms of our personal lives, it's been much more difficult for us to be together with loved ones and family members and friends, and we've had to do things much more remotely using technology. There have been times when we felt perhaps more comfortable with bubbling in the summer with social circles in the summer, but that had to be discontinued with the second wave. All of this, of course, has been very hard on our well-being, our mental well-being. Children have lost long stretches of in-class education time and have had to endure education being done remotely instead. So, very much many impacts on us all. There is, of course, the light at the end of the tunnel with vaccination, and we are making progress on that, but we've really only reached perhaps 4% of the population with immunization. We're only just beginning. We've gone to protect those who need it the most, so our population in the long-term care facilities and the retirement homes are now largely protected, and we're already seeing a dramatic improvement in terms of outbreaks and cases and mortality in those settings. But the great majority of us have yet to get our vaccine, but we've got the stage set so that we're ready to give it en masse. And we've been told, we know that these vaccines will be coming. We've had 4 of them now that are approved in Canada, with the Johnson & Johnson vaccine anticipated to be coming by April. Yet another easier to use vaccine for us, and therefore it would be very helpful for us. So certainly light at the end of the tunnel, and I remain optimistic about the progress we'll make to the summer, and over time, as we get more and more people protected, the decline, I hope, in numbers of cases. We have this concern about a potential third wave with the variants of concern, but we also have at our disposal vaccination, and we have the ability as individuals to do what we can to reduce the risk of transmission in our lives, to ourselves, to our family members, and to others. So we've got the tools to be able to proceed, and I feel confident that later in the year we'll be in a much better, safer, and happier place, healthier place. But as we go through that, I think it's important that we do our best to be kind to each other. This has been hard on us, and it can certainly be hard on our feeling about things and about each other. And certainly I recognize that, and I would encourage people to be kind to themselves and note how they're feeling about things, and be kind to others as well as we work together to bring this under control. So at this point, I will work through some of the media questions that have been submitted to me. So based on a year of local data, do you support or recommend gray being changed at the provincial level to allow small businesses like hairdressers, nail salons, small gyms to remain open? And what I would say is we do need, at the top end where you're getting a high amount of transmission, a framework that truly protects people and reduces the movement of people, and reduces interaction with people, and reduces places that have been associated with some transmission. So there have been outbreaks and transmission in those locations. They're actually not the locations where the great majority of outbreaks and transmissions have happened, but across the province, those places have been impacted. So I would say that I would support the province as they look at these things, and whatever changes would come from the province, ultimately I would support. but I wouldn't rush to make those changes. While the health unit was hesitant to go to red, do you feel this is a good thing when taking into account the many kids who need sports outside of school to keep mentally and physically healthy? So I would say that indeed I am happy that children in red are able to do more of that. That's certainly important for their health and their well-being. And I am well aware of and regret the harm that is caused when we have to go into tighter restrictions. We do so in order to prevent transmission and mortality from this virus, but I'm aware that it causes other negative impacts on health and well-being, and therefore we need to be balanced about that and careful about it. As we look ahead to the summer, are you considering any travel or tourist restrictions or measures to control the spread of COVID-19? And I would say I'm hopeful for the summer. I don't know for sure what it will be like, but if we're very fortunate and are able to immunize well and keep the variants of concern under control, we stand a reasonable chance of having a good summer. Maybe very much akin to last summer with low counts, low transmission, maybe even better, we shall see. So I'm hopeful for the summer. I am always cautious about travel because if you have areas that are really hard hit for COVID-19, travel between such areas and other places can lead to spread. So we'll have to see what the summer looks like. I would be generally following what the province's leadership would be on this. And so far, the province's approach has really been to advise about travel, but not to actually prohibit travel. There has been some discussion about our region fluctuating between red and orange, and what would our numbers have to look like to be in orange. And what I would say is that if we look at our numbers right now, strictly speaking, you could make the case we could be in either red or orange. Our case count per 100,000 population per week would be in orange, but the framework doesn't take into account the variants of concern. And I have seen data actually looking at the other health units that are in red, and a number of them too actually have some figures that would put them in orange. And I think what my colleagues are doing is taking into account the variants of concern with their advice to the province about where we should lie. I think we need to be very careful and not change quickly from red at this time. Would you consider Simcoe Muskoka ground zero for the UK variant, and if so, why? Since we saw it at Roberta Place, are we doing better than expected, as in did we expect the variant should have been a lot more prevalent? Well, I actually do consider us to be in the province ground zero for the B117 UK variant, in that we have more of it than elsewhere. And we had it before others in terms of large numbers, just very unfortunately because of the large outbreaks in facilities that we had that really augmented the numbers and spread to households of healthcare providers who were part of responding to those outbreaks, and then from there into the community. Indeed, it was taking off again in our community, spreading geographically elsewhere in Simcoe County and in Muskoka and in other work environments. So up till a couple of weeks ago, really, I was seeing it taking off. But it appears for the moment now that it has crested and come down a bit. So that's good news. I'm not completely certain as to why that is. And I think we still need to be cautious because we know this is highly communicable. People need to be continuing the precautions they're doing. Businesses need to be continuing the precautions that they're doing, that they have in place to keep it going in the right direction. I think the fact that it's come down a bit is cause for commendation to everybody that we managed to achieve this so far, despite the fact that these are more transmissible cases of COVID-19. But we can't rest on our laurels. We have to continue with what we're doing that's gaining some success. So once the province has its site up and running, I think this is with regards to immunization booking, okay, will the Simcoe Muskoka District Health Unit's website link through to the provincial site, and how will you ensure people don't fall through the cracks with the switchover? So what I would say is we have our own booking system, and it's a very good thing we have our own booking system, because if we didn't have it, then right now we would not be in a good position to be able to book the present cohort that is to come through, those that are, well, we've said 85 and above, and the very high risk, high priority healthcare workers. We would have a hard time figuring out how are you going to book them without a booking system. So very glad that we have it. Not all health units have it. And when the province gets its system in place, I think we'll carefully transition into their system. The communication that I've received from the provinces take a little bit of time about it to make sure that all works well before we would decide what to do with our own booking system. Why are we hearing advertising that vaccines are now available to 80-year-olds? And the next phase is rolling out that will allow people with certain conditions to get vaccinated, yet your website says differently. So what I would say is the province has indicated that as of March 15th, they will be taking bookings for people 80 and above. And so locally, indeed, we want to get to the point that by the 15th, we're able to do that. But in fact, that's a very large population of people. It's almost 30,000 people. And so we've decided to start with 85 and above at this time, who would be at a greater risk than those between 80 and 84, and to allow 85 and above to come through before we would then open it up to 80 and above in time for the timing that the province had indicated we'd be doing this. And as for individuals who have health conditions that would put them at higher risk, that's to come online with phase 2 of the province's immunization plan. Right now we're in phase 1, so we'd be getting ready for phase 2, but we need to continue providing immunization to everybody who's still in phase 1 before we get to phase 2. We shall see exactly when that begins. Because we're able to postpone second doses for people, we can move through these groups more quickly to be able to get on to phase 2. And we will announce that when we're ready. I would also say that by that point, with the province's booking system, it'll be really the province that's driving these things, driving the timing of these things, because they would have that one booking system that would then place people in clinics across the province, including in ours. So at that point, I think it'd be very much theirs to call about the timing. Okay. So how will people know when they can book an appointment during the appropriate phase? And that'll be public communication. And where we have subgroups that we can reach directly or indirectly, we'll do so for communication. So when it's been healthcare workers, we've been able to reach them through a health fax that we provide to healthcare providers. And when it is the individuals that are 85 and above, we've asked family physicians to help notify their patients who are 85 and above that they can book with us. And so when we get to other age groups, we'll take the same approach. And when it comes to other professional groups that would be eligible to receive vaccine at a certain time, we would approach their professional associations to put out that communication. So when it comes to patients that have medical conditions, I would anticipate that family physicians would be very helpful. Primary care providers would be very helpful to be able to identify these people and to notify them of the opportunity to receive immunization. And when we get to the point where we can actually give vaccine to family physicians, they could potentially be booking them to come right into their office to receive it as one of their options. Would you consider offering vaccines 24/7 if vaccines are available? Are we getting all 4 vaccines in this area? So with regards to the vaccines that we're getting in this area, we've had Pfizer all the way along. We'll be starting with Moderna later this week. and AstraZeneca will be soon, within a week, receiving some as part of a pilot to primary care. And as for the Johnson & Johnson vaccine, that'll be coming probably in April, is what we've been told. And then there's a question here about what's happening with wastewater testing in Barrie or other municipalities in Simcoe, Muskoka. What are the results of the wastewater testing showing? And I've already walked through that. So at this point, I'd be happy to take questions.
Dr. Gardner, we're going to start with Chris Simon from the Barrie Advance.
Thank you very much. Dr. Gardner, looking through the list of outbreaks, 4 of the active ones are in manufacturing facilities. In terms of workplaces, manufacturing facilities are the highest sources for outbreaks. Has there been any discussion at the health unit level of maybe some greater enforcement or targeting these sites for some kind of educational campaign or anything like that?
Thank you for the question. The letter of instruction that I'm issuing will be received by them as well, and certainly we've been taking lots of calls all the way along from businesses and workplaces about requirements of that nature. We'll continue to take calls and give instruction. We at certain points have done Zoom meetings with businesses. So in the spring we did that, in the fall we did that, and within a month I've done that with our local MPPs about enforcement, about safe operation, that type of thing. So we don't have the capacity to go on site proactively a great deal. We did that with the province in its interministerial enforcement blitz about a month ago, along with bylaw enforcement officers. So we take opportunities like that when we get it, but I think, really we're doing what we can, and we don't really have the capacity to be doing more in the way of proactive on-site enforcement.
Does the province's announcement about increases to supply of immunizations, does that at all bump up when you expect the general population in Simcoe, Muskoka will have access to a shot?
Well, it helps because as we get through our priority groups, we get closer to being able to open it up to the general public. And as the supply increases, production and provision to us increases, that too speeds us towards the point where we're able to move through into phase 2 and then phase 3, where we're making it available to everybody.
And just one more question, if I may. Have you been surprised? We've seen some fluctuation in numbers, and you've talked about the variant, especially in water testing, going from being able to see trace amounts to not seeing it indicated at all. Are you surprised by the movement of the variant? When it came here, we were concerned it was going to get out of hand very easily.
It didn't. Certainly I'm relieved that it's taken a downward turn. I was very concerned that it wouldn't do that, considering how it's behaved in other places. It went contrary to my concern, but it certainly went in the direction of what I would prefer. And it's not finished yet. I think we can't take things for granted that they'll continue in that direction. We still have to be cautious.
Thank you.
You're welcome.
And we'll move on to Mark Bruneman, please.
Thank you. Can you touch a little bit more
about the staff on the wastewater test locally, folks. The one that's done for COVID and the second one that's done for the UK variant.
I'm just going to repeat your question because it wasn't that loud. I just want to make sure it gets picked up on the camera here. So you're asking for me to reflect on the value of the wastewater surveillance, both COVID-19 overall and the variants of concern. Did I get that right?
Yes, you did.
Okay. So it's another tool. Surveillance really is a matter of looking through multiple lenses, multiple sources of data to get an understanding of disease and where it's headed, and to therefore get a better sense of what we need to be doing about it. And so this gives yet another source of data. The City of Ottawa has actually been doing this since the first wave, and in the summer they found it helpful in that they actually saw the rise of. Sorry, I'm hearing some background noise. If people could mute, that would be great. Thank you. So they actually saw the beginning of the rise of COVID-19 in their wastewater before they saw it in cases reported to them. It had less of a lag in time. So that was their earliest warning that things were starting to go in the wrong direction. And then later on, as things peaked, and they peaked earlier than elsewhere in the province in the fall, when their numbers peaked and started to go down, they were further reassured that their wastewater samples testing was also showing the same thing. So it corroborated and gave them a greater degree of confidence in what they were seeing. So perhaps that gives you a bit of a sense as to how it could be useful.
Great. And now that you're reporting that the Brazilian variant is on our community, is there any hope of testing for that and perhaps any other variants that come up in the near future?
So thank you for that. The province continues to screen for variants of concern and to do genetic sequencing for those that screen positive. I'm not sure how they'll change as they go forward on that. I do know that they are developing new approaches to testing. To me, it is helpful to be able to know, at least to some degree, if we have different variants here. The key is to know for sure that you've got variants happening of any kind. And I think another really key thing for us is if in fact we're close to, like definitely most, but if we get to the point where essentially all of our cases are variants of concern, then at that point it becomes less valuable to test for this. We get to the point where we say, well, we assume that all of our COVID cases are variants of concern. They are more transmissible, and therefore people need to be so advised and act accordingly and take according precautions. So we're in a transition right now before we get to that. We're getting close to that, but it is, to me, helpful to be able to know which variants we have. The fact that we now have two of them is of interest to me. We know that the B1351 variant from South Africa it also is in the province, but we haven't had it identified here, but it would be helpful for us to know that too if that happens. So during this transition, it's helpful. Later, as we decide that essentially they dominate and we assume all cases are variants, it becomes less necessary.
Specifically for wastewater testing for these other variants, do you see that as a possibility?
Nobody has offered that to us at this time, so I'm not aware that it is. But then again, many things have been developed along the way during the entirety of the pandemic, including new modes of testing, so that could change.
Thanks for those answers.
You're welcome.
Thank you. We're going to move on to Erica Engel from Collingwood Today, please.
Hello. My question is, you mentioned something about the AstraZeneca pilot with primary care. Could you explain that a little?
You know, I think I'll leave it for now because it is something from the province. So I think I'll leave it at that.
Okay. I was wondering if you'd seen a shift in the ages of people testing positive for COVID-19 since you've been able to vaccinate long-term care and retirement homes. Are you noticing the average or the median age is lowering?
It's a good question. I haven't actually looked at that. I do know that our cases from long-term care facilities have dropped dramatically, and the Science Advisory Table for COVID-19 for the province just put out a report that identified a dramatic drop, like more than 90% drop in COVID cases and deaths in long-term care facilities recently with immunization.
Okay, and just one final question. You spoke before on vaccine waste and just the possibility of, if people don't show up for their appointments, what happens with that. Could you provide an update on how much waste there has been and how you're dealing with that?
We essentially have no waste. We have a waiting list that we can draw on to call people in at a moment's notice in order to get vaccine.
Thank you. We'll move on to Sean Gibson from Barrie today, please.
Hi, thank you. Just wondering about one of the numbers I see is the current active UK variant cases at 6. And that's what brought to our attention as well. There's a lot of numbers out there. And I don't know if you spoke about this one, but that looks like a really good number. How much attention should be at that number?
You're talking about 6, like in the past 24 hours, I gather, is what you're referring to? Like you said, there's a lot of numbers, right? Yeah. I usually don't put a lot of stock in a single day. I look more to a trend over the week and then week after week. What's happening this week versus the previous week. So I think looking at a single day probably isn't all that helpful.
And secondly, like you were mentioning that we've kind of fluctuated between red and orange. The province's numbers have been fluctuating back and forth. Depending on how the province goes, if we're at this space, if we're at orange or red in 2 weeks, regardless of where the province is, do you think we could possibly move into orange, or how much attention should be put to that?
I wouldn't be advising that now. I think we need to be careful and measured as we go forward. But I will be looking at this week after week and looking at the trend and seeing how it goes. It's favorable over the last 2 weeks. We shall see where it goes from here.
Perfect. Thank you.
Welcome.
And we'll go to Matthew Reisner from Moose FM, please.
Hi, Dr. Gardner. Thank you for doing this as always. I spoke with a resident recently whose school-aged children and close family members contracted the virus. And she's a little frustrated. She's the mother. She's a little frustrated with the poor communication they got from the health unit from the time that the positive test came back until pretty much today. Could you explain what the process is when a student does contract the virus? How quickly is a school notified, and in what direction, if any, are they or the school board given on how to handle it?
So we are notified through the Ontario laboratory system. We get our result within 24, 48 hours, generally speaking. We then contact the individual. Our target is within 24 hours, and as I pointed out at the beginning of today, we're now at about 70% on target for that. So it's going to be within probably 1 day, but it could be as long as 2 days for us to be able to get communication with the case and then take a history and find out that in fact they're an individual who's at a school, and then we get to the school within as quickly as we can within the day. in order to work out who the other contacts are. Through the case, we find out who the other contacts are as well, but also the school as to where they've been, which classes, who else needs to be notified for exclusion. And then we work with the school to get out a letter as quickly as they can. So that can, if you do the math, it could be 2 or 3 days from the test being taken to be able to get that communication out. And I've heard certain people have approached me with concerns, and in those instances, I go over the situation with my staff, with the management in the program, in order to determine what the timeline was, what happened, whether there were any lost opportunities to be able to do it better.
Now, in conversation with her, she said, in fact, that I believe she got the test result on a Friday, and it was her actually that was the one that ended up informing the school and some of the other parents that she was close with about the situation, about the fact that her child had COVID and would have to be staying home. Does that make any sense to you? That the fact that she was the one that had to reach out to the school herself and inform them that my child does have COVID, and did that before the health unit got to them?
So there may be instances where an individual knows before we do, given the timeline I've described, and if they proactively do that, then they're, I would say, helping the system. If they reach out to us, that's certainly very helpful. And that way we can all work together to be optimal about it. Certainly we strive to do it to the utmost of our ability, given the kind of sequence that I'm describing.
And one more question for you on this. She is a part of a blended family. Her kids live at 2 different houses. Does the health unit have a protocol for how to handle that if, for example, one child does go from living with the mom to living with the dad for a weekend? Is there a protocol in place for how to handle that, or is that left up to the family to figure out proper quarantine procedure just to talk to them?
So we have to work with all kinds of situations and living arrangements, and we use disease control principles to work out exactly what would be required and give direction accordingly and adapt it to the situation at hand.
Okay, thank you, Dr. Gardner.
You're welcome.
Mike Arcelides from CTV Barrie, please.
Doctor, hello.
Hello.
So here's the question. Where are we at right now with supply of the vaccine? I saw today on the list that it looks like we took a little bit of dip in administered vaccines over the last 24 hours. With regard to folks who have received their first vaccination dose, are those people who have the appointment set right now going to now be pushed that extra allotted time now by the province, or can they maintain that? Where do we stand here with supply in our freezers?
So thank you for the question. The province has indicated we're going to be getting about the same quantity of Pfizer over the next 2 weeks, and then it will increase greatly, twofold or more, 2.5-fold. We're going to be starting to get Moderna later this week, so that gives us more to work with right away. We have been instructed that as of people who would be booked from the 10th onward for their second dose, that we are to look to follow up with them and extend out their booking, give them a new booking that's the 4 months out in the future from their first dose. With certain exceptions, the province has instructed us to provide second doses within the prescribed duration by the manufacturer. For Pfizer, 21 to 27 days. For Moderna, 28 days. For those who are residents of long-term care facilities or retirement homes, and those that are elderly that are in congregate settings. So we're going to be working towards those instructions from the province.
So if you're an 87-year-old grandmother of 7 great grandkids, and you got your vaccine in Muskoka Beach today, you booked your second appointment, is there a possibility that can get moved to a later point down the road as per what you just told me?
There is, yes.
And does that speak to a very, very, very scarce supply right now in Simcoe, Muskoka?
Well, this is not just about Simcoe, Muskoka. We're following direction of the province, and their overall intention is to provide the first dose of vaccine to more people more quickly to protect us all, basically. If we can all get to the point where we're immunized sooner, then we're all much better off, and the transmission of virus greatly reduces and potentially leads to the kind of herd immunity where even people who aren't vaccinated are protected because of the high immunization rate that exists among everybody else. So it's meant to have that kind of benefit.
So with regard to supply, because as I'm sure you've heard and seen, our friends to the southwest of York region, Monday and Tuesday this week opened up consecutive days of new bookings of 2,000, 3,000 vaccinations per day, and they were swallowed up right away within 6-7 hours. We had no such thing here in Simcoe, Muskoka. Does that simply speak to the supply allotted to a greater population and maybe a greater need in a hotter spot, so to speak, in York region?
Well, the allocation, in the past, it's been based on the need and the incidence of disease, and so there were parts of the province that were delayed till some weeks later before they got their first dose. There was more of it allocated to the Greater Toronto area, where they've had not only a bigger population but a much higher incidence of disease. And the province even now has identified hot spots to get more vaccine. We're fortunately for us, not fortunate that we're a hotspot, but fortunate that we're identified to get more vaccine, that we're on that list. York is a bigger area in terms of its population. So, I really, other than that, I really wouldn't be able to speak to the numbers that you're raising.
Okay, thank you very much.
You're welcome.
We're going to move on to Beth Hartill from Muskoka region, please.
Hi, Dr. Gardner. To follow up with the fellow from the Moose's conversation, the other issue with that family is that the blended family has kids that go to different schools. How do you handle that, or does the TLDSB handle that? How is something like that generally followed through on?
So I cannot speak about the details of any one case, but we are the ones who investigate the cases, investigate all their contacts. We have contacts that are in their immediate household, contacts that are out of their household. If it's a situation with more than one household, we identify them all, we follow up with them, and we identify who needs to be put into isolation. And if it's more than one school, then we're working with more than one school. If it's more than one school board, we're working with more than one school board.
Okay, thank you.
You're welcome.
And we'll move on to Mark Claremont from Muskoka region, please. Mark.
Thanks very much. Regarding the Brazil virus, Dr. Gardner, did you say there were 2 cases of that? And is it as contagious as the UK variant?
So just to confirm, we do have 2 cases of the P1, it's called, a variant originally identified in Brazil. There's not as much known about it. According to the Center for Disease Control website and the information they have posted, there was some association between it and a wave or surge of cases in Amazonia and a portion of Brazil. And so the concern is that it would be more communicable, but it's not as well understood as the B117 UK variant.
Okay, thanks. And also, did I hear you correctly earlier on when you spoke about it's been the 1-year anniversary, and I believe you said that Simcoe, Muskoka, and I stand corrected here, had the first case of COVID, and that first case died. So it was a person in Simcoe, Muskoka had the first case of COVID, and that person died. Correct?
Yeah, it did. I'll restate it, make sure I'm clear.
That's okay.
It wasn't the first case of COVID in the province, but it was the first death. And that case was also our first case in Simcoe, Muskoka. So we had a case which died, our very first case on that date, and it turned out to be the first death in the province.
But it wasn't the first case in Ontario.
No, but it was our first case.
Yeah, definitely.
Yeah.
Right. That was just a year ago today, wasn't it?
On the 11th of March, which coincidentally also was the day that the World Health Organization declared COVID-19 to be a pandemic.
And it's also a National Day of Observance here in Canada, apparently, this coming Thursday. Okay, thanks for your help there.
You're welcome.
Has there anyone been missed on the option to ask a question of Dr. Gardner?
Hi there, it's Ian from Barrie 360.
Welcome, Ian. Go
Hi,
ahead.
sorry, late getting on. Doctor, you made mention of the be kind to each other. You offered a bit of light at the end of the tunnel with regards to vaccine rollout and toss in a nice day like this. Don't want to put you on the spot. It may not be your call, but the Midland Butter Tart Festival was canceled. Here the CNE and Agriculture Fair will go on this year. Other events in Toronto have been canceled for July 1st, etc. Are you concerned there could be a mishmash of some events going ahead in some places and others being canceled? And I'm just wondering if we've looked ahead to the summer when we do have a lot of activity and a lot of crowds that like to gather, or are hopeful that this time they will be able to, unlike last year.
Thank you for the question. We would be looking for municipalities to come forward to us with proposals so that we can go over what would be advisable and what would not, or how they would have to be changed to be safer. Certainly right now would not be an acceptable time to be doing events of that nature, large gatherings. We might find by the time we get to the summer that we're in a different place and that things are under much better control. I certainly hope so, but at this time we really can't know for sure.
I appreciate that. Thank you very much.
You're welcome.
All right, and is there anyone else that joined us late and didn't get a chance to ask a question? It appears not. Thank you, Dr. Gardner. Thank you, everyone, for joining us today. I think this wraps up our media briefing for March the 9th.
Thank you, everybody. Bye-bye.